Early morning in the lobby.
Greetings to everyone, and we want to welcome you to our first segment of Health Matters.
Health matters, and your health matters to me.
And so today, we want to talk to you about the opportunities we have with the state of Alabama and the Alabama Rural Health Transformational Program. And we have with us a very, very special guest, my dear friend and our advocate and supporter, Representative Pebblin Warren. And she has agreed to take time out of her busy schedule and sit and talk with me today, because one of the things I have ascertained is that Representative Warren's heart is in health. And so she has been an outstanding advocate for us as we move through these processes and help direct us in the right path that we should go. So greetings,
Thank
Representative
you,
Warren.
and hello to everyone, and thank you so much for inviting me, because this is one of the things that I know we lack in Macon County, and that's communication and educating the people to let them actually know what's going on. They don't, so I think this is a true valuable time that we're going to spend this morning to discuss health care.
That's great. And so one of the things we wanted to get into is a lot of times people talk about the negatives that's going on in Macon County. So as the chairman of Macon County Healthcare Authority, our goal is to highlight what we do have in healthcare and move forward to what we can obtain. So with that, this opportunity came up out of the big, beautiful bill, the Alabama Rural Health Transformational Program. They have 10 initiatives that are going to be funded this first year, and we were fortunate enough to apply for 3 of those in the first round, and we're looking to apply for more in our second round as we move forward. So in that first round, we applied for rural health practices, and rural workforce. So under the rural health, we wanted to deal with the fact that we want to extend the hours at our clinic, Thomas Reed Clinic. We want to increase the services that we have. We were fortunate enough to be able to get a 3D mammography machine now, and that's the top of the line, where our citizens don't have to travel out of town to get mammograms. That service. And in rural health practices, we're trying to get funding for a mobile clinic that can go out into the rural areas of the county. And then rural workforce is increasing the number of doctors and physicians and nurses that are in the area. So I did a quick synopsis of that, but I'm going to tell them a little secret. A lot of that came from you.
Well, I think that it has been a concern of mine for some time as to where we were with health care. One of the main reasons is I know we have a senior population, I know we have a low-income population, and I know we have a university in this city. Those are all the reasons in the world that we know something needs to be done. So in looking at that, and when the big, beautiful bill came up, and then the governor appointed me to the panel, I said, oh God, I said, now it's an opportunity to get in here and do the best that I can and try to support Macon County to get the funding. But I think that we're really on the right track. It's not going to happen overnight, because we all know all these things are contingent upon funding. And another thing, I want the people to understand that as we continuously bring in business and industry, not only are we bringing in jobs, we're bringing in revenue for the municipality, we're bringing in revenue for the county, we're bringing in revenue for the school system, and we just got to, get together and make sure that we have our priorities in order. And I think healthcare should be on the well. Now I always tell them, I said, get your finances straight first. Get all your bills paid, get everything done.
Right.
And then secondly, we need to look at healthcare and we need to look at education, because if we want to see this place grow, get new populations coming here, these are things that are vital that we're going to have in place to attract anybody to come in.
That's exactly right. And when we were looking at this too, with Macon County Healthcare being for the whole county, we included the municipalities, Tuskegee, Shorter, Franklin, and Notasulga. In this second round, we're looking at what may be able to happen with the EMT treat in place. We currently govern the ambulance service that's in Macon County, and we have people that complain sometimes, but I think that in a crisis, you think something happens. It takes longer for something to happen than it really does. And I'm speaking from experience, because when I lost my husband, it seemed like it took the ambulance 4 hours to come, but it really didn't. And so we keep a tight rein on that, have the ambulance service provide us with monthly updates. And see, a lot of people don't know that Thomas Reed is a CLEAR certified lab, and there's very few in the area. You mostly have them at hospitals, but Thomas Reed has a CLEAR certified, so that we can do the cancer tests and treatments and through. So being the only female on this statewide committee that's dealing with this health is a, I'm just gonna go ahead and say it, it's a gem in our pocket. You know, Macon County Healthcare Authority has the only representative female on there that can work for us, and you have certainly been doing that.
Health matters, and your health matters to me. Every breath, every choice, every small